The entire contents of this podcast and website are based upon the opinions of Tammy Garcia and her guests, unless otherwise noted. The information on this podcast is not intended to replace a one-on-one relationship with a qualified healthcare professional and is not intended as medical advice. It is intended as a sharing of knowledge and information from the research and experience of Tammy Garcia and her guests. This is the Naturally Inspired Podcast, coming to you from our 1890 homestead in Johnstown, Colorado. I'm Tammy, and I want to thank you for joining us. Let's get started and help people feel good so they can do what they love for longer. Today on the Naturally Inspired Podcast, Dr. Colleen Holland joins us. Dr. Holland completed her doctorate in 2001 at the Sherman College of Chiropractic. She has a master's in Medical Humanities, a bachelor's of science in biology. She has multiple certifications as a Fertility Awareness Educator, an advanced pregnancy practitioner of Arvigo technique of Mayan abdominal therapy. She is Webster technique certified and board certified from the National Board of Chiropractic Examiners since 2001. Welcome, Dr. Colleen Holland, to the Naturally Inspired Podcast. So first off, I just wanted to thank you so much for being on the Naturally Inspired Podcast today. I'm honored that you've come on with me here today.
Well, I'm excited to talk with you, and if we can share information that helps people, gosh, that's great.
Yeah, that's my hope here today. I just want to, I think we're going to bring some new information to people, and we're going to open people's minds a little bit before they make decisions about reproductive health and their bodies in general.
Mm-hmm.
So with that, can you tell me a little bit about yourself so our listeners can get to know how fabulous you are? Where were you born?
So I was born and raised in New Jersey, just outside of New York City. But then I left there when I was 17, and I spent about 10 years up and down the East Coast at different schools, and finally came to Colorado, where I'd been for about 18 years, and this is home for me.
Nice. And where in Colorado do you live?
Fort Collins, Colorado.
Yay. Love Fort Collins. Do you love living there?
Oh my goodness. Yeah, it's a beautiful town.
And what do you love about it?
Well, I love the laid back nature of the people here. And having lived on the East Coast for so long, it was a sharp contrast when I first moved here. And the beauty too, the mountains and the waters, and just being able to be outdoors a lot. The lack of humidity was really nice to move. So yeah, it felt like home immediately. This was when I first moved here, was supposed to be a temporary move for a year or two. I was going to help a colleague open a practice.
Oh, really?
I joke that my temporary move has been almost 18 years now.
Wow. Yeah. It's funny how our decisions kind of shape our life when we're not even expecting them to, isn't it? Can you tell me a little bit about your family? I know you were married.
Yes, I am married to the love of my life, Carl, for about 16 years, 15, I can't even remember, 16 years, 16 and going. And we have an amazing daughter, Mia, and she is 15.
Lovely. That's awesome.
Yeah.
So tell us, how did you get started in natural medicine?
Well, gosh, so I was interested in pre-med when I was in undergrad. I thought I was going into medicine, and the more I learned about medicine, I was working in an ER, I was working on campus with our health clinic, and I had a great mentor who was a medical doctor who talked with me about medicine, and we had a lot of conversations in our downtime about what I was looking for and what I wanted to do. And it was a lot of very honest conversations that started me thinking that maybe allopathic medicine wasn't the right choice for me. So wow. Yeah. And just seeing kind of how it worked in the day-to-day. And I thought, there's a lot to be said for emergency medicine.
Yes, I agree.
A lot to be said for it. It's an amazing offering, and very grateful that we have it. But beyond that, healthcare, I wasn't really seeing that in allopathic medicine enough. And I thought that I really wanted to be in healthcare, and I wanted to work with women and children. And I didn't feel like I could provide healthcare going to allopathic medical school. So that's when I started looking into other things, and studied medical humanities, and ultimately decided to go to chiropractic school. And while I was in student clinic, I had the great privilege of being able to work with pregnant women and children. Our school was really big on family care, and every body needs support, and every body needs adjustments to improve the nervous system. And so that's what my education was in. And so I just fell in love with working with that population. So when I got into practice, I specialized in perinatal and pediatric care, and I did that for many years. So that's basically what got me into natural medicine.
Wow, that's fascinating.
Mm-hmm.
That's fascinating. What a gift that doctor, your mentor, was that open with you, so that you could really get a full spectrum of what it would look like to be an allopathic doctor, and then to recognize that that's not really what you wanted to do. I mean, that's really
I am so grateful to him for having those conversations, because he went into medicine wanting to do the same thing I wanted to do. And at that time, in the early to mid 90s, it was starting to change with managed care, and it was just becoming very different. And his ability to practice the way he wanted to was not there. So he gave me some good, honest advice.
Yeah, and I think you're dead on with allopathic medicine when it comes to chronic illness and things they don't have the answers to. But with emergency medicine, it's obviously we're incredible at that.
Oh goodness, yeah, best in the world.
Yeah. So you kind of shifted when because you went into chiropractic care, and you were treating women and children in chiropractic care. But was there something that you started to see in your practice? Because you kind of shifted your focus. Not only did you want to treat women and children, but you started to kind of see something, a need, I'm thinking. So you shifted your focus more towards fertility. And can you tell us what made you make that shift? What was going on there?
Sure. Well, working with this population for so many years and seeing thousands of patients, it was very clear to me that they were suffering quite a bit. So I'd have women with horrible menstrual periods. I would have women with repeat miscarriage, difficult pregnancies, difficult deliveries, and then their postpartums. For them, sometimes their thyroid would crash, and you'd have postpartum anxiety, depression, just feeling awful and drained. And then babies also, a lot of the infants I was seeing, so many of them were on baby Prilosec and other kinds of drugs. And what I was seeing, just kind of taking a step back,
baby Prilosec. Can you tell me what that is, please?
Oh my goodness. So it's a
because Prilosec's for GERD, or like heartburn, right?
Exactly. And so that's what they're using it for in children. And it's extraordinarily common. I mean, I would say half of my peds practice was on baby Prilosec in those early few months. And usually it would peak around 6 to 8 weeks, and baby would be suffering with GERD, reflux, and that was their solution. That was the only thing they had. And so I was,
So this is something that was like back in the day, I think they called it colic, right? When a baby was super fussy all the time or whatever, he would often get diagnosed with colic.
Right.
And so this is their solution to colic?
It's colic, plus it's some reflux and the disruption in the backflow from the stomach into the esophagus. So it's kind of a more complexity than colic, but I wonder if some of the colic diagnoses are related to that. So babies are suffering for sure, but the only answer they had was pharmaceuticals. And so as a chiropractor with a functional medicine background and understanding in nutrition and the importance of the microbiome, I could see where people needed support and they just weren't getting it. And so just seeing so much suffering in this population, and then the subfertility as well with moms, I got a clear picture that women, and therefore their babies, were completely depleted. A lot of deficiency, nutritional deficiency. And started putting pieces together, and I realized that it has to do with, our approach to women's health long before women ever think about becoming mothers. And that is that we can suppress their ovulation and their menstrual cycles until it becomes important for them to have a family. And this is a real problem in our thinking, because you can't suppress menstrual cycles, the thing that makes women women and their ability to bring life into the world, without suffering consequences down the road.
Right. And I think that's something we're not thinking about when we're making those choices, because we're not really made aware. The side effects of suppressing your menstrual cycle are explained to us like it's nothing. It's no big deal.
Exactly. And so essentially, I was trying to send people to their gynecologist, trying to, direct them into what to ask for. But ultimately, no matter what their complaint, no matter what female ailment any of us experience, we're essentially offered three options. One would be antidepressants to make you feel a little less crummy about how crappy you feel, or some kind of hormones therapy, usually synthetic, or surgery. And those are your three options in allopathic medicine. And so I know that there are many, many more options than that. And so it became like kind of a mission for me to start finding more options and just bring them to the awareness of my patients, because I wanted them to be well. I didn't want them to just have a Band-Aid solution that was actually going to cause more problems down the road and wasn't ever going to address the underlying issue, which was deficiency.
Right. So when people are showing up in your practice, they're having common complaints, having complaints of just not really feeling good. Maybe they're struggling with postpartum, some emotional stuff, definitely. And you were able to detect that, hey, this is really about deficiency here.
Yeah, and a lot of it is nutritional deficiency. And then if they've been on any kind of prescription, including hormonal birth control, then all drugs actually create nutrient deficiencies, because the energy required to process the drugs by your liver and the rest of your body uses up a lot of nutrition, a lot of micronutrients. And so there are always deficiencies when we take a pharmaceutical. And sometimes the pharmaceutical benefits outweigh the nutritional deficiencies, and especially if we can be aware of that and try to make up for some of those deficiencies. But you have, in our culture, in our society right now, young women being put on hormonal birth control or suppressive drugs, suppressive cycle drugs in their teens. And often not for birth control, but for other symptoms such as heavy periods or acne or irregular periods, which all can be addressed in a much more healthy and holistic way.
Right. Or simply for the inconvenience of having a period.
Exactly. Yeah.
Like,
Yeah.
this is such an inconvenience that I just don't want to deal with this. So I'm just going to stop it. And
Right. It's because we don't value the importance to a woman's health or a girl's health, the healthy cycling of her body. We just don't value it.
Right. And I think the consequences, again, are not being, they're not being shared. The consequences of these things are not being told. It's just common. Oh, you have acne, go on birth control. Oh, you have, unruly periods, go on birth control. But that's a signal, right? If you're having trouble.
Yeah, we actually call, in my profession, we call it the menstrual cycle, the fifth vital sign. Because in medicine, we have vital signs. Whenever you go to the doctor, you get your temperature taken, get your blood pressure taken, your heart rate, your breathing rate. Those are the four basic vital signs that all humans have. And as a person, as a human with a uterus and ovaries that cycles, you have a fifth vital sign, and that is your menstrual cycle.
Yeah, I love that you say that, because it makes perfect sense. This is something your body's doing every single month. And if it's dysfunctioning, hello, it's trying to tell you something. And I always, when I write about things in natural health and stuff, and I always like to try to explain it to people that, hey, your body's talking to you. It's not, the symptoms are there to guide you, to try to get you to pay attention. And when we shut the symptoms up, it doesn't mean the deficiency or the problem has been fixed, correct?
Right. And the body talks to us all the time. Unfortunately, as women, we're always taught to disregard those messages from our body. So whether we have painful periods, irregular heavy periods, or any kind of pelvic pain, pain with intercourse, or recurrent infections, we're taught that we really shouldn't address them. Like, it's just part of being a woman. You know, you might have, for vaginal infections, they'll slap some antibiotic or some antifungal creams for you, and you're expected to use that, but you're just expected to not think about it beyond that. And in functional medicine, we have a very different approach. It's not a Band-Aid approach. We want to get to the root cause of the problem.
Right.
And so many women suffer because no one is willing to address the root cause of the issue. And no one is willing to admit or recognize the importance of regular ovulation, and therefore regular periods, real periods for women or girls.
Right. When you say real periods, can you explain that a little bit? What's a real period versus a suppressed period? Or
Sure.
yeah.
Yes. So a real period is a result, a biochemical result within the body of having ovulated about 2 weeks prior to the bleed. And so when we're cycling naturally, we have our period, and then we have a lead up to ovulation. And then once ovulation occurs, we have the second phase of our cycle, which we're producing a lot of progesterone during that phase of our cycle, which is really important for our overall health.
Mm-hmm.
And if we don't ovulate, then we're not making that progesterone. And then once we have had that progesterone production, a couple of weeks after our ovulation, if there's no conception, then our cycle will start all over again. And that's when we get a true period after ovulation.
Okay.
If we're on some suppressive drug, like any form of synthetic hormone, then our body doesn't go through the same cycle. It actually stays at a kind of a static place hormonally. And we don't ovulate, and that's how it works. That's how it keeps us from getting pregnant. And so when we have the bleed on some forms of birth control, it's a withdrawal bleed, a withdrawal from the drugs. And so it's not a true period. And that's really important to distinguish, because so many women and girls are taught that the pill will regulate their period.
Yeah.
And it does no such thing. It completely eliminates your period, but you will get an artificial withdrawal bleed if you're on the type of hormonal birth control that allows for that. So the pill with the sugar pill week, or the ring where you leave the ring out for a week. So those are just withdrawal bleeds. They're not true periods.
Wow, that's fascinating. And I'd never heard anybody explain it quite like that. I know that, the sugar pill is what it is. It's the placebo. You don't need to be taking it, but it's just to keep you in the habit of taking the pill. So I kind of understood that. But as far as the function of the cycle, and it not being a true period, I did not know that really to that level.
Yeah, when they first invented the pill back in the 1950s, women were objected to not having a few days of bleeding because it was very unsettling to them. They were used to bleeding for several days every month. And so the inventors of the pill actually put that placebo week in there to provide some peace of mind for the women taking it, to make them feel like they were still healthy and normal. So isn't that interesting? And now we've come really to 180 degrees where we have experts, quote unquote experts, I'm using air quotes, who say that women don't need to have periods.
Right. It was intuitive back then that, hey, this can't be good for me.
Right.
If I'm not having a period at all, like this must not be healthy for me. And then they just kind of, we'll fix that then. We'll give you a fake period.
Right.
And that will settle you.
Mm-hmm.
Wow, that's so interesting. There's definitely at times when I experience stuff that's going on around my cycle, where I'm now much more aware of it from working with you in the past and whatnot, that, hey, wait a minute, now I can go to this and say, is this because this is where I'm at my cycle, that I'm thinking this way, or that I'm whatever, because it does affect the way you operate. But yet we're told that if it does affect the way you operate, then you're weak because you're emotionally not stable. You're just a hysterical woman. But
Yeah.
there's a physiological thing going on in here.
You know, absolutely. There are apparently 4 phases of our menstrual cycle. In Chinese medicine, they talk about this a lot.
Mhm.
And I agree with that. And women are supposed to be dynamic. We're supposed to cycle. That is part of what gives us our feminine gifts, which are the ability to see things from various angles and the ability to understand the importance of relationship. And, you know, we have masculine and feminine energies in this world.
Right.
And our patriarchal culture has historically only honored the masculine energies. And we see that in the way that women are expected to act like men, perform like men, and be static like men. Not that men don't have their own natural rhythms, but you know what I'm saying.
Right. Yeah.
And so if we're able to recognize and appreciate the feminine principles, then we can bring both of those together and have the best of all worlds. But in order
Yeah.
to do that, we
Balance.
need to allow women to cycle and to ovulate and to do what their bodies are supposed to do. Because
Right.
that's the only way that, one, they can be as healthy as possible, because we need to ovulate and have cycles in order
Mhm.
to have the amount of hormones that we need to naturally make to have health, not only through our cycling years, but even well beyond menopause to carry us through. You know, there's implications for suppressing our ovulation and therefore not making our own progesterone and estrogen in adequate quantities that
Mm.
affect our bone health, our heart health, our brain health, our risk for cancer as we age.
Right.
Yeah, it has implications, and if we can embrace both the masculine and the feminine, we'll all be better off.
Agreed. Agreed. So when you're seeing people come into your practice, what are their chief complaints? What are you seeing any kind of pattern with maybe your clients that are coming in? Are they saying the same things over and over? I have this symptom, I have that symptom. And if so, is there a place where you can pinpoint where this breakdown is happening?
Yeah, so I would say commonly I'm working with women who are having more challenging periods. So either they have a ton of PMS or they're having spotting, painful periods. I do a lot of work with women with endometriosis and PCOS, two things that I have personal experience with. And so there's a lot that women experience, and I'm sure it's not surprising to hear this, but you know, the pain and the heavy bleeding and the spotting and then the what we call short luteal phase, meaning, and it usually ends up in a shorter cycle. So women cycling every 20 days as opposed to, you know, 29, 30 days or 27 days.
Mm-hmm.
And it's somehow disrupting their life and giving them distress
Yeah.
and making them feel really disconnected from everything. And also really, it's very off-putting because it can become burdensome
Right.
when your cycles are not healthy.
Yeah.
When your cycles are healthy, bleeding monthly shouldn't be a big deal. You know, you just need some help catching the blood so you can do what
Right.
you need to do. But if you're able to understand how your body works and to improve your fertility and make it more robust, it should improve your life and it shouldn't become a burden. But so many women have burdensome menstrual cycles, and especially periods.
Yeah, I can speak, just from my circle of friends, there's so many that have struggled with different symptoms from, painful periods to missing periods altogether,
Mhm.
to spotting. And then I want to talk too about the emotional side of it. I have some friends that, have expressed to me that I literally feel normal. And I'm quoting here, I feel normal once 1 week out of the month.
Yeah,
I'm
I've heard.
either dealing with premenstrual stuff, the actual period, or the aftermath of it.
Mhm.
It's at this point, and I'm in my 40s, and so that's who I'm mostly speaking with about this, and that's what they're dealing with. They're dealing with these constant issues, and then when they go to see a doctor and all the testing, I'm doing air quotes too here, has been done, nothing's found, everything's great, so they're offered Xanax.
Right. Yep. Yep. So a lot, and it does crop up in the 40s, but I'm actually seeing it cropping up in the 30s and even for some women in the 20s. I think it's with each
Wow.
generation, it's showing up sooner and sooner. And I think
Okay.
that has to do with compounding generational deficiency.
Okay.
And so Yes, women feel awful. And that's generally because they're not in hormonal balance. And
Okay.
it's generally because maybe their guts are really unwell and we need
Okay.
to address some gut healing. But it's
And
very
so how does the gut get so off balance? We hear a lot about gut health nowadays because they're starting to admit that this is actually an issue. I've even heard of people now that going to the doctor and getting prescribed probiotics, which
Mhm.
is exciting to
Right,
me. They
right.
gave you probiotics? That's
Yeah,
awesome.
it's a good first step for
It
sure.
is a good first step. But what is it that is making this gut biome so sick?
Yeah, we have in industrialized cultures, so in the West here, we have a very deranged understanding of what food is.
Hmm.
With processed food, we we're taught that processed food and everything that we see and is available in our grocery stores is real food when it's most of it is not.
Right.
And so a lot of the work that I do with people is just getting them to understand what real food is, because that's what they want to be fueling their body with. Everything out there that has multiple ingredients on a package, most of that is not going to be something worth putting in your mouth. I know it tastes good and it can be comforting, and that's what everybody else is eating, but it can be a huge paradigm shift, but a worthy one, to start to really look into what food is best for your body and what micronutrients and macronutrients we need. And I think that's a big part of it. So we have generations now of us who have been eating non-food generally, and for the most part, or
Right.
a lot of non-food items. And this has a very big impact, negative, on our gut health and our microbiome. We've heard that term now for the last
Yeah.
decade. It's a real
Yeah.
buzzword. And it really is, it's microbiome is just a balance of the bacteria in the gut. We have a vaginal microbiome, we have an eye microbiome, we have a skin microbiome.
Right.
And it's really all about keeping everything in balance so that all of it can work best and function well. And our guts have not been doing well. So if we're looking at processed food, that's one influence. We also have so many toxins in our environment, herbicides and pesticides around us, fluoride in our water, chlorine in our water, all kinds of things that can really do a number on our gut health. And when our gut starts going down, it inhibits our ability to be able to absorb the nutrients that our body needs to be able to function. And so just
Right.
from that simple standpoint, and then our gut and hormone production are very much entwined. So we could do a whole podcast on that. I won't do
Yeah,
that.
maybe we will.
Perhaps.
Because
Uh,
I definitely can see a trend here. It's affecting people in their 20s, sometimes even in their teens.
mhm,
Then there's got to be more to what we're putting into our body
mhm,
than what we think.
right.
Um, and it's just compounding. And I know, and without getting too much into it, there's xenoestrogens too, which is another factor that we have to deal with. Can you talk a
Yeah,
little bit about xenoestrogens?
sure. Yeah, so xenoestrogens are estrogens that are not made by our body. So they're not bioidentical to our estrogen, but there are other compounds in the environment, some of them natural from plants, some of them unnatural from chemicals that can act like estrogen in our bodies, and in some cases can have a higher affinity for our own estrogen receptors than our own natural estrogen.
Right,
So, but yet they don't act the same way that our own natural estrogen does. And so this can become a heavy biological burden on the body.
right. And cause dysfunction as well.
Oh, absolutely. And one of the biggest ways that people can reduce the effects of xenoestrogens on their body, well,
Mhm.
I'll list a couple of ways. One is to eat organic food as much as possible and
Right.
the best quality meat you can afford. The other is to get rid of and eliminate all fragrance in your body care products, in your shampoos.
Oh, interesting.
Yeah, fragrance is a estrogenic type compound. It's phthalate with a P, PTH, that's how it's spelled.
Okay.
Phthalates are what keep a fragrance in your hair, or on your body, or in your clothes throughout the day. It's the staying power of fragrance, and
Okay.
those are xenoestrogens.
Oh
So
my goodness. I
think
didn't know
about
that.
the cleaners, yeah, and you don't have to go completely scent free in your life. There are some essential oil type scents that you can use, and non-phthalate fragrances. But for the most part, everything out there that is perfumey is going to be disrupting your hormone balance to some degree.
Wow.
So you can reduce the burden simply by eliminating that, eventually phasing out all of your perfumed stuff for non-perfumed stuff, and avoiding herbicides and pesticides, and trying to minimize eating and drinking out of plastics, which is another great source of xenoestrogens.
Right. And as a kid of the 80s, I know I just threw plastic in the microwave in Tupperware and zapped that sucker up. No big deal.
You're getting your daily dose of xenoestrogens.
I mean, that thing was just like moldable. It was so hot by the time I took it out, and we didn't think anything of it.
Right.
And I'm not here today to talking about this with you to scare everybody, but just to make you aware that, hey, I know you're not going to be able to take all of this stuff out completely, right?
Mm-hmm.
But when you look at all the little things and how much they add up over time, then you can start to realize, wow, this could be disrupting my cycle. This could be causing some of these issues.
Mm-hmm.
And now how can I make small shifts towards something else? I know a friend of mine just threw out all her Tupperware or, plastic containers. I don't even think they were Tupperware, but just plastic containers. She's like, I'm not going to do that anymore. Good.
Mm-hmm.
That's one thing, one easy thing, right?
Perfect. Yeah. And I always tell clients, as you're replacing items, just then replace them with something that is less toxic, has fewer fragrant, no fragrances. So you don't have to just do a full sweep of your house right away, unless that's your personality. And I do have some people I work with that are like, that's it, I'm doing it now.
I might be a little bit like that.
Yeah. But even the simple act of next time you buy new laundry detergent, go ahead and switch it out for one that's unscented.
Right.
Or has like a little orange oil in it or something like that, or lavender, that's not a fragrance type, an artificial fragrance.
Right.
And just each time do that. So whatever you can do, it does make a difference. Overall, just decreases the burden on your body.
Right.
And the reason why we see this happening as we get into our 40s is because think about the burden that we've had on our bodies for so many years.
Yeah.
And then if we're not ovulating regularly, which is something that we can talk about, just because you're bleeding every month and you're not on birth control doesn't necessarily mean that you are ovulating every month.
Right.
And so if you're not ovulating every month, you're not producing very much progesterone. And that can make you feel horrible throughout your cycle. Progesterone is a feel-good, relaxing, calming hormone, helps you sleep better, decreases anxiety. And if you're not making enough of that each month, then you're not going to feel good. So you were talking about some of the women who just have a week out of each cycle that they feel okay.
Yeah.
But they're not making enough progesterone.
Interesting. And so what happens though is we usually get put on a estrogen birth control.
Right.
So we get more estrogen when really what we need is progesterone. What would be the best way to, get more progesterone back?
Yeah, one of the best ways is to avoid the xenoestrogens because you're reducing that load, and to improve gut health. You want to be able to get your own body to make enough progesterone. And you can do that with improving gut health, making sure your thyroid health is good as well, which is another big issue, especially for women in their 40s. I see it come up a lot. And those two things, cleaning up the diet, getting the gut health better, making sure your thyroid is healthy, reducing xenoestrogens, usually goes a very long way to increase progesterone production. There are some women, depending on the age, they might need bioidentical progesterone supplementation. That's a case-by-case determination.
Right.
But in general, those three suggestions help most women.
That's
liver. I should mention too that when you clean up the diet and you improve the gut health, you inevitably improve liver health. And the liver is an organ that is responsible for many, many functions. We can't survive without a liver ever.
Right.
And so if our liver is burdened by a lot of toxicity or high blood sugar that creates kind of a fatty liver issue, or we're taking a lot of pharmaceuticals, then the liver is not going to work optimally. And in order for us to have healthy hormone balance, we have to have our liver working optimally. The liver has a job of, after you're done with the hormones that your body has made and utilized, it needs to break down and metabolize them for excretion. And so if the liver is unable to do that, you'll have a bunch of old circulating hormones, and oftentimes it's estrogen and estrogen metabolites. And that can lead to a what's called unopposed estrogen situation. Sometimes people call it estrogen dominance.
Yeah.
And so, so supporting the liver via supporting the gut makes a
Right.
huge.
And would you say that a big issue today, because we're seeing a lot of young people with fatty liver disease, and from what I've read, it's mostly because of this enormous amount of sugar that we're taking in. Everything processed is laced with sugar, even if it's not like an item that you would think would be full of sugar. It's still like ketchup. Ketchup's got tons of sugar in it. A lot of people don't know that. So there's these hidden food items that you think, oh, it's not that bad. But when you're stacking all of these food choices on top of each other, it's easy to see why we are being overloaded with sugar.
Yeah.
So not only do you have to work on your gut health, but reducing your sugar intake could help you regulate your hormone.
Absolutely. There are 10-year-old children with non-alcoholic fatty liver disease,
Yes.
6-year-old, 8-year-old children. And it is a direct result of our diet. And there are some genetics that play a part, but diet overwhelmingly, and like you said, sugar, and then the highly processed, industrialized processed vegetable oils are also kind of creating a lot of inflammation and just a really bad situation for liver health.
Right.
I think we talked about it last time we met, is that this generation is thought to not outlive their parents' generation.
Yes.
And I think so much of that is related to the processed food diet.
And us as parents, I look at it not only to make small shifts in my life to improve my health, but when I make a choice in the marketplace, I'm voting for what I want to see on the shelf. And so that's also another part to making responsible decisions in your health and your food choices, nutrition. You're setting your kids up for what's going to be available to them. We have to do that. We have to demand in the marketplace what we want to see more of. And so when you're making these decisions, it's not just about your health. You can look at it, because oftentimes, especially as women, we need to make it about other people. We need to make it about the people we love. We need to make it about other people. So use that to your benefit when you're making your choice at the grocery store. I'm buying this for myself and my own health, but I'm also buying this because I'm tired of seeing all the garbage on the shelves. That's the way I started to kind of look at it.
Yeah, and getting your partner, getting them involved as well. So it's not all on your shoulders, especially if you have a family with children, because it's a lot to juggle. I get it. I spend a lot of time in food preparation and cooking.
Planning.
I know that it's worth it, and it's still a lot. And so if you have a partner, getting them on board is incredibly helpful.
Yes, I would agree with that. I think it's when you're trying to make lifestyle changes, we've talked about it here on the podcast before about immersion, how if you're immersing yourself in the lifestyle, which is what you need to do to be successful with these types of changes.
Because you're worth it. Yeah.
Absolutely. And so are the kids. Yeah. And so is everybody, really. Nobody should be putting this stuff into their body.
Right. It takes effort and it uses energy to be able to do that. But you're either going to spend the energy and effort preparing the food and feeding your family well, or you're going to be spending the energy and effort going to doctor's appointments, taking antibiotics, feeling unwell, suffering with, who knows, fibromyalgia, Crohn's disease, endometriosis, PCOS, insulin resistance, diabetes. The list goes on and on. So how do you want to spend your resources and your effort?
Yeah, exactly. Exactly. If you can make it fun. I know a lot of times my daughter and I, if we're doing it together, we'll throw on a movie in the kitchen and just get going on it so we can, and make it like a family activity. And then it's not so burdensome and it's so worth it. So we talked a little bit about birth control before, and I do want to dive into this subject because I think it's really important, especially with our young girls who are kind of, used to just hitting a certain age and going on birth control. So I want to talk about that, and I want to talk about the parent side of that too. So how does birth control play into some of these symptoms that we're seeing in women?
I first want to say that I understand the challenges and the worries. I was a teenage girl. I'm a mother of a teenage girl. Yeah. I understand these questions and what needs to be considered. Uh, Birth control is a drug that's generally given to a healthy person to suppress a healthy function. And so it automatically has downstream effects that are compromising on the body.
Right.
So we talked about the gut. Birth control can create more of a leaky gut situation. So it does degrade gut health and integrity. It also suppresses the thyroid gland, because once you suppress so I'll give you a little biochemistry lesson here briefly.
Yeah.
So the menstrual cycle, obviously we think about the ovaries and the uterus, but what communicates to the ovary is when to make estrogen, when to make progesterone, and that's the brain. So in the brain, we have a hypothalamus gland, and then we have a pituitary gland. There are a lot of others, but those are the two that are most intimately involved in the menstrual cycle. And so when we take a hormonal contraceptive, what it does is it sends a message to the hypothalamus in the brain saying that you don't need to make any estrogen, you don't need to make any progesterone. You can shut down the signaling to the ovary, because those synthetic hormones, though they don't act anything or much like our own estrogen and progesterone, they do fake out or psych out the brain and tells the brain we've got enough hormones, we don't need any more. So it shuts down that cycle.
Right.
So when we do that, it also has an effect on other hormones in the body as well. And we think about hormones related to the menstrual cycle, but hormones are really active in all tissues of the body. So they affect the bone, they affect the GI tract, like we said, they affect the breast glands, they affect the brain. And so we need them. We need our own natural hormones for optimal health of all of those tissues.
Right.
So if we only think about the period, not even the whole menstrual cycle, but if we only think about suppressing the period and the ability to conceive, we're really short-sighted here. So
Right.
there may be a time in a person's life when they decide that the downsides and the risks are worth it to them to have this contraception. And I totally respect that. I
Yep.
think if women know how their bodies work and how these drugs interact with how their bodies work, and they can educatedly make that choice, I support them 100%.
Agreed.
I think if women knew the whole story, knew how their bodies worked, and knew how these drugs interacted with how their bodies work, they might choose to use them for a shorter period of time, more sparingly, or maybe even look into other options. And there are other options that don't compromise your health. And
Right.
so I just want women to have all the options. I want them
Right.
to understand everything that's available and understand how their bodies work, because that is one thing in our society, it's so taboo. Women's bodies are so taboo. And the menstrual cycle is like the peak of taboo. And
Right.
so we have been raised in this era of taboo about natural function of our body. So we are completely in the dark about how our bodies work. And that's what I am trying to undo. And so many of my colleagues who want others to understand just what it is to have a cycle, what happens within the body, and what you can learn from your body. So we talked about the idea of the menstrual cycle being a vital sign.
Yes.
And so if you learn how to look at your cycle, understand what's going on in your cycle, and make observations about your cycle, you can learn a lot about your health. And
Right.
so even just aside from the whole birth control aspect, it's really valuable for women and girls to understand how their cycles work. So I hope I answered your question there. I think I might have gone on a little bit of a tangent.
No, you did. When it comes to birth control specifically, and the period suppression, we're seeing some side effects. I personally know people that have had side effects with this shot that's pretty popular to get. Do you see people in your practice that have had some fallout from the shot?
Oh gosh, yeah. The shot is one of the versions of birth control that I think has some of the most dramatic effects, negative effects on women's health and their cycles overall. And I've had many, many clients say to me that they go and they get the shot, and then they weren't warned that they would have no bleeding or anything like that, and they freak out. They think that something's wrong, and that's because the offices where they're receiving it are not educating them about what it does. But the shot is actually one of the ones when you come off of any hormonal birth control, the shot is usually the one that takes the longest for people to return to natural cycles. And so it's a very, it's a 3-month shot. So if you were on the shot, you get it every 3 months. It's a pretty significant amount of synthetic hormone. It's called medroxyprogesterone is the drug. And it's not progesterone like our body makes. It's a synthetic form. And it has a pretty overwhelming impact on that hypothalamus, pituitary, and ovarian axis that we were talking about earlier.
Right. Are you getting 3 months worth of hormone in one shot then?
In one shot, yes. Yes.
So the brain is absorbing all of that information
3
months right in.
Right. And it just shuts things down really hard and really fast. And some women have some pretty negative side effects from it. Others do better, but that's the same with any drug. And one thing I want to mention is that, I am not anti-birth control. I'm anti-educated, informed consent.
Yes.
One of the things.
Freedom of choice here.
Yes, yes, absolutely.
It's all about your choice. We just want to give you the information today.
Right. And women are not getting the information. In fact, it's discouraged to discuss all the potential side effects in a doctor's office, because then it might make them actually experience the side effects, sort of create this reverse placebo effect. So that's why it's not really talked about. But if you were to open up the package insert, which you're not given when you go into the office, you might have to ask for it from your pharmacist or from the doctor's office, you'll see a long list of potential side effects. And you will also see on many birth control options something called a black box warning.
Yes, I definitely want to talk about that.
Yeah.
So before you move on though, I just want to say that that's a really good point that you're making, that, the side effects and whatnot, they're dealt with at the pharmacy. Well, by that point, you're in a different frame of mind. You've already, accepted the prescription in the doctor's office. You've had a conversation with your doctor. You're just going to pick it up at that point. I don't think anybody reads those things. No. I think they end up on your floor in the car, quite honestly.
6-point font,
Yeah, it's this tiny thing. So that would be one change I would say that we could make pretty easily in women's health, is to take the time out in the doctor's office to say, okay, what is this? And what are its real side effects here? And how are people, dealing with the side effects? Are they worth it? So they can make an informed decision at that point. And you are the very first person that has ever told me about the black box warning. So there's a whole thing. And what I found after our pre-interview, when I went on to do some research, is that black box warnings, you can find all the information right there online. It's on, different pharmacies' websites. All you got to do is type it in, but you got to know that there's actually a black box warning designation.
Right. And the black box warning, for your listeners, is the strictest FDA warning given when a drug has reasonable evidence of serious harm.
Yes.
And so they are required to put this black box warning on any drug that fits those criteria.
Right.
And several of the birth control drugs available today do carry a black box warning. Not all, but the shot does, the patch. Yes. Any pills containing drospirenone, drospirenone.
Right.
And then even the eSure, which is a sterilization technique, also has a black box warning.
Right.
Yeah.
And so that's something you really need to be aware of, because from what I read, it sounds like maybe these black box warning drugs, because they actually apply all across the gamut. It's not just to birth control, right? There's sleep aids and all kinds of drugs that they apply to.
Sure.
And so what I gathered from the information was that these should be used in very short periods of time if you choose to use them at all.
Mm-hmm. Right.
So definitely known people who have been on these black box drugs for years at a time.
Yeah, it's common. It is. And that's another reason why it's just important for women to have the information, not to scare them,
right,
but they need to have the information so that they can make the decision that's best for them.
Right.
And one of the problems is that they are typically not presented with all the information. Something that I am expert in is fertility awareness method. I'm a certified educator of the method. And most doctors do not understand what it is, and therefore then actively discourage their clients from looking into it.
Right.
And then, back to even the basics, condom use combined with withdrawal. The two together, extraordinarily effective
Right.
contraception. Yeah.
Especially if you understand your cycle.
Yes. Yeah, absolutely. Yeah.
Yeah. Which is what is one tip that if a parent, because I'm the parent of a daughter, and after learning what I know now, I'm concerned about this. I'm concerned about her making a decision about birth control in the future. What would I don't want to leave her with no options, right?
Right.
But I want her to understand that, hey, you could really potentially feel pretty bad after this one decision in your life.
Right.
Once you start, it's a process of undoing at that point, right?
Mhm. Yeah.
So I'm with you. I totally understand the parental concern here. But what would you say to break it down to a parent that, hey, this is your option, since this is kind of your mission is to educate people on this. What would you
Mhm.
say to them to bring them along with maybe giving this a shot?
Yeah. So I would start with, in order for a young woman to be able to make healthy choices and choices that are best for her body, she needs to understand how her body works.
Yes.
And so if as a parent, you do not understand how your body works, please educate yourself. There are some great books I can share with you. I don't know if you can share that with your readers.
Oh yeah,
Okay,
absolutely. What
one
are
book
the titles?
is called The Fifth Vital Sign, and it's written by Lisa Hendrickson Jack. She's a colleague of mine, a fertility awareness educator,
Hmm.
and she's written a beautiful book, the best out there on fertility awareness method. Read that book as a parent. If you have, a 10 to 15, 16-year-old daughter, you can share Tony Wexler's book, which is called Cycle Savvy, and it just gives them a better understanding of what's happening through their cycle.
Hmm.
And there are, The Garden of Fertility by Katie Singer is another great one, more for adults. But once you learn how the cycle works, then you'll be able to communicate to some extent to your child. And
Right.
then there are those of us out here out in the world, fertility awareness educators, we all work, almost all of us work remotely, and we can provide additional like fill-in education support.
Right.
Um, if you're local to Fort Collins, Colorado, I've taught teenage classes to just both boys and girls, helping them
Yeah.
understand how the cycle works.
Right.
And really
That
just,
would be a great way too, is to kind of change the way we're educating
oh,
about sex in the school. We're not really covering what matters.
that's another podcast.
Yeah.
Yes, I agree. I agree. And it's hard. There's politics in school districts and getting
Right.
comprehensive sex education. Um, but it's so valuable. And so if your school is not doing it, I think parents should do it anyway. It's vital information. So don't be shy about it. And if you need help, reach out to someone who does provide some of that support. But
Right.
those books are a great place to start. And then just really having open conversations with your kid as much as possible.
Yeah.
My kid gets bombarded with it. She has
Yeah.
throughout her life. When we're in the car, I'm listening to podcasts that are specifically talking about menstrual cycle health and fertility,
Right.
and that, Lisa Hendrickson Jack, who wrote The Fifth Vital Sign, has a beautiful podcast called Fertility Friday. It's another great
Yes.
podcast to listen to.
Yep.
So there are resources out there. And
Right.
then I just recently, and you'll have these conversations over and over again, but every once in a while, my team will ask a question, and it's so helpful. And she's like, what if my friends just can't do fertility awareness method? Then what can they do? And I said, well, they can always use a condom every single time. And
Yep.
the young men can pull out with the condom on every single time.
Right.
And if they do those two things every single time, they're going to have a lot lower risk of unintended pregnancy, STDs.
Right.
And that's so simple, but we don't teach that in our society. We don't teach young men, this is expected of you,
Right.
that you can use a condom and pull out every time, because
Right.
it's going to make your life better, your partner's life better, and still allow you to have pleasure.
Right.
We hold back on suggesting anything that could potentially reduce male pleasure at the cost of female health. And
Right.
so,
Well, and because the awareness is not there, the awareness for the consequence of taking these types of birth control is not there. So they figure, well, why not? There's no consequence here. So might as well just cover our butts and get everybody on birth control. But
yeah,
that's not the case. There are some severe, severe side effects.
right.
Maybe we could mention a few too. I have heard different symptoms coming from birth control, everything from achy joints to depression.
Mhm. Depression, loss of libido, which is really unfortunate and often minimized. And that is a really important part of a woman's life, is to
Yeah.
have a healthy libido. I don't
Right.
want to minimize that at all, but that is one of the most common side effects
Right.
of birth control. And that's no fun. You shouldn't have sex when you don't feel like having sex. And so many women on birth control are continuing to have sex even though they have no interest. And that's
Right.
that's not women's lib. That's not what we've been
Right.
fighting for, you know. So headaches, IBS, thyroid suppression, so hypothyroidism, weight gain, um, lack of interest in life. So part of that
Right.
depression, anxiety, panic attacks, certainly higher rate of blood clots that can lead to stroke. And we've lost a lot of young women to birth control because of that, pulmonary
Wow.
embolism, stroke.
Right.
So I'm sure I could list dozens and dozens. Vaginal dryness and increased vaginal infections because the pill changes the activity of the cervical cells
Mm-hmm.
and it changes the microbiome there. So we're
Right.
much more prone to vaginitis, to cervical dysplasia. We're more susceptible to any kind of STD or STI, so HPV and AIDS and any STI.
Interesting.
So it lowers the immune system. It
Right.
really just has a real global effect on the body
Right.
beyond just avoiding pregnancy.
Right. Well, mineral deficiency in general, which is, you mentioned that earlier, any medication kind of compromises your absorption of minerals and may decrease your ability to get them in. So that makes sense.
Yeah, I
That
do
makes
want to
sense.
mention one thing that I feel like is really important and I don't want to forget. And it goes back to teaching us how our bodies work. And one thing that I was never taught, I learned it when I was in my 30s, was that we make cervical mucus as our lead up into ovulation. And then we can not only know that, but we can also observe if we know what we're looking for. We can
Right.
observe cervical mucus when we wipe ourselves after we go to the bathroom.
Right.
And that means that we're in our fertile phase when we are noticing cervical mucus. And that's the direct reflection of the level of estrogen in our body. But I think that all girls should know to look for cervical mucus.
Right.
One, to
And
help
that it's not unhealthy.
that it's not unhealthy, exactly, to make sure that they don't think it's infection or anything gross. And two, to know when they're in their fertile window.
Right. Because knowing when, because there's really a small window of when you can become pregnant.
Right,
And I
right,
think that's kind of a misunderstanding.
right. It's about, on average, it's about 8 days of the cycle, and that can vary. And it's simply because of the cervical mucus. Sperm can survive in cervical mucus for about 5 days.
Hmm.
And so in the lead up to ovulation, we will have some of that cervical mucus because biologically we need cervical mucus in order for the sperm to reach the egg safely.
Right.
Vaginal pH is really low, very acidic.
Mhm.
Sperm pH is much more neutral. And so when we don't have that cervical mucus that's available for the sperm die really quickly in the harsh environment of the vagina, harsh meaning pH wise.
Right.
Yeah.
Okay. Interesting. So we talked about the kind of the younger side of birth control. What about this kind of phenomenon I like to call of people returning to birth control in their 40s, having been off it for a while, having already had their kids and stuff, but then maybe having spotting again. This will regulate your period. What are the side effects of that for someone in that stage of their life?
Yeah, the side effects are the same. And it really depends on the woman's overall health, how much of an impact that's going to have on her. And if she's having problematic cycles in the lead up to perimenopause, probably
Yeah.
that there is some improvement that can be done with her health. So,
And you want to do this before you hit
yeah,
menopause, right? Like this is how I feel now that I know what I know is that, okay, some things aren't right with your cycle. It's time to fix it, because if you don't, when you start going through menopause, you're kind of going to be in a bomb.
oh yeah. Yeah, like I said earlier, the being able to produce estrogen and progesterone in adequate amounts throughout your cycling years has a long-term effect, not only through your cycling years, but even beyond. And how well your hormones stay balanced through your cycling years will predict with pretty good accuracy how smooth a transition your menopause will be.
Right.
And so if you're having some difficulty and you're wanting to fix that difficulty, from your general doctors, you're just going to get the option of, Mirena or the pill. Usually a lot of perimenopausal women will go on the Mirena because it lightens the flow and it reduces some of those, the spotting and that sort of thing. It's not a solution. Same as when you're younger. It's not a solution. You still have to address the root issues, which is gut health. And often for women in that age group, thyroid is huge.
Right.
So if you're not looking at the thyroid and you're just band-aiding the bleeding, then you're missing a huge, huge aspect of that woman's health.
Right. And so I know we had a functional medicine doctor on a couple of weeks back, and she was really concerned about the fact that older people are staying on birth control longer.
Mm-hmm.
And she's having women come to her at the point where they've been on birth control so long, and it's kind of scary.
Yeah.
So what are the reasons why we should not really be on birth control as we get into our 50s and 60s?
Really, the main reason is that it's not a solution.
Yeah.
And we need to address the real problem. And we're doing women a great disservice. We're putting them on a Band-Aid drug like that. That can also cause lots of other health concerns.
Right.
So we're not doing them any favors. We're increasing their risk of certain types of cancer when we put them on hormonal birth control. And if the woman is postmenopausal, but she's having vaginal dryness, or she's having bone loss, bone density issues, which is one of the more common reasons to keep women on hormones after menopause, there are simply better ways of addressing that do not compromise her health.
Right. That's very good for sure. So to back up a little bit, someone who is in their fertile years and trying to get pregnant, and this is another piece that I think is just lacking in awareness. People just been on birth control for years and trying not to get pregnant, and it's kind of a weird thing when you finally be like, okay, I'm ready.
Yep.
I remember feeling that way, like I'm just gonna do this. Okay, roll the dice. But there really should be some preparation.
Absolutely. Yeah.
Can you talk about that? What's
yes.
we be proactive in preparing to get pregnant?
So a large number of my clients are women who are trying to become pregnant or having difficulty and have been on the pill for 10, 15, 20 years of their cycling lives. And this is a real issue.
Yeah.
I tell couples, if you're planning on getting pregnant within the next 2 years, get off the pill now. Get off the patch now. Get off your method now. Use the condom if you need to. Learn how to chart your cycle so that you know when you're in your fertile phase, so that when you're not in your fertile phase, you can learn when to time sex. But I honestly don't want women or couples to get pregnant within certainly not within the first 6 months of coming off the pill, and sometimes for up to 2 years, depending on their health. Because the objective here is not to just give them a baby. I want them to have a healthy baby.
Right.
And that, I cannot stress that enough.
Right.
There is much greater risk if you come off the pill right away and you get pregnant right away. Women have done it. It happens all the time.
Yeah.
But like we were talking about at the beginning of this, deficiency. So
yes.
I like to take that 6 months to a year to replenish the nutrients lost, improve the gut health, get the thyroid health on track, make sure the woman's fertility is robust, her health is robust, because that will give her a much healthier pregnancy, a much healthier baby, and a much healthier postpartum. And having worked with this this population for so long in practice, I don't wish that kind of postpartum on people. I have
Yeah.
seen it be really hard on families, and
Yeah.
it's so difficult.
Yeah.
So I want to get them to a really good place where their fertility, both mother and father, are robust. Dad's not off the hook here either, because in order for his
Right.
sperm to be healthy, he needs to have a good diet. He needs to have good thyroid function. And if his sperm is lacking and unhealthy, she can suffer a miscarriage as a result.
Right.
And so that can be hard on both of them.
Yeah.
So I would make sure both of them are able to get in a place where we can all feel like, all right, if pregnancy were to happen this cycle, it feels really good that everything would be
Right.
super
We're starting from a great point.
healthy. Yes. Yeah.
So essentially, the mother's health and the father's health has a great deal to do with how the pregnancy will go and how the baby will come out as well.
Absolutely. And then what that postpartum period will be like.
Right.
And
But how much preparation do we get in allopathic medicine for getting pregnant?
it can be none.
Yeah.
Absolutely none. Yeah. Yeah. And you just can't compare the functional medicine approach to preconception to
Right.
anything that you would get in a gynecologist's office or reproductive endocrinologist's office. The RE wants to get you to a viable baby.
Right.
And that's just a totally different goal.
Right.
It's a valid goal. It's a goal that's appreciated by couples, but I want more than that for the couples I work with, because I have worked with them after the baby gets here, and I
Yes.
see what happens when you don't address the foundational issues that need to be addressed before pregnancy even occurs.
Right. That's such an important area. And that is why, correct me if I'm wrong, but that's why you kind of shifted your focus in your practice to helping people get ready for pregnancy
Exactly.
so that you can then be on the proactive side of it, right?
Yeah, I got
Yeah.
really tired of like emotionally tired of trying to fix the aftermath and support couples in the aftermath. And I wanted to just focus on before so we can avoid that type of aftermath. I just wanted healthy families to be able to enjoy, creating a family.
Right.
And too many people these days experience unnecessary suffering when creating a family.
Right. It's definitely, I mean, I'm really speaking anecdotally here, but there definitely is way more trouble getting pregnant from my perception
Mm-hmm.
than there used to be back in the day. I don't remember hearing so many people struggling to get pregnant. One other question I wanted to ask was when you're talking about young girls just starting their period, how many years does it take for them to kind of get a true period?
Mm-hmm.
That was
Yeah.
something I didn't know either that you educated me about.
Yeah, so full maturity of our menstrual cycles can take, anywhere from 5 to 10 years. It takes usually the first 2 years before we start to regularly ovulate.
Right.
So in those first couple of years, the cycle can be a little more irregular, um, not always ovulatory, and so that's normal. That's par for the course. Um, Generally, symptoms around those first few years of periods in teens are more related to like acne and painful periods, are more related to their nutrition than
Okay.
it being normal for the first 2 years. I don't, a little bit of cramping maybe, but nothing where you would need pain relievers. Um,
Interesting.
can be something that a girl will experience, but generally, if her gut and her nutrition are really good, she's not going to suffer.
Wow. That's fascinating. So when you're working with people to get them ready, and not everybody is going to be able to go to a functional medicine
Mhm.
practitioner, obviously. I would highly recommend it, especially if you're thinking of getting pregnant, or even if you're dealing with a teenage girl and you want to learn more about this. I would highly recommend consulting with you. But what are 5 tips that you could give people for their reproductive health and for their cycle health in general?
Mhm. I think the things that have always come up when working with clients that can be the most helpful are, one, nutrition, which I always say is just foundational. So if you do nothing else, work on improving the quality of nutrition. And The second thing I would say that I think would be easy is to eliminate toxins in your environment. Like we were talking about the fragrances and the chemicals and the herbicides and, Roundup on your lawn, but you don't need to do that. Just get rid of as much of that as you can, and plastic. Start drinking from glass or stainless steel. Those little things can all add up and compound to better health. And then this is something that we all strive for, we give a lot of lip service to, but decreasing stress. So many of the couples that I work with are under tremendous stress. And, things like they have a job that they hate. One of them has a job that they hate, or they're in a situation where there's someone toxic in their life. I'm just going to ask and encourage to be brave and just make the decisions that you need to reduce those stresses in your life. You're always going to have stress of some sort. There's always going to be, but if you can change and get rid of the stress sources that are possible to get rid of, be brave and do that. Get rid of those people in your life who are not good for you. Change your career if you can and need to. Think about saying no a lot more. These basic things, but like really, it's so important for you to get a load off of your shoulders. And if you can find any areas of your life to decrease your load and enjoy more of your life, just more joy in your life, then do it. So it sounds like a simple thing, but it's actually really big. If you can do that, and then easily just get on a good quality B complex or prenatal. And when I say a good quality, it's generally something that you get from a practitioner, not a Walmart or Costco brand. You want it to be something with B vitamins that are methylated, so you don't want folic acid, you want folate, which is the form that our body needs. Folic acid is synthetic, and for a lot of people, it's really hard to be able to utilize that. So your B9 and your B12 are really important B vitamins, and you want them to be, for your B9 to be folate, and for your B12 to be methylcobalamin versus cyanocobalamin. That sounds like big words, but if you're looking at your products, do look and make sure that you're getting methylcobalamin and not cyanocobalamin, which is the cheap version.
Right.
Yeah.
So quality nutrition.
Yeah, quality nutrition, and having that extra support with a B complex is something simple. A lot of people like to add fish oil too. Again, a nice quality fish oil that's been tested to not have mercury is important.
Yes.
So
again, be aware of those toxins.
Yeah. And so I'm putting kind of like three things into this category here, but probiotic rich foods, like fermented foods, yogurts, if your stomach can handle them. There are different varieties of yogurts. So just beyond nutrition and eating well, those supplementary type things when it comes to B complex, fish oils, and probiotics are generally good for everyone.
Nice.
And then finally, one thing that's often overlooked is thyroid. Are there any thyroid symptoms there? Look, Google thyroid symptoms. If you have several of them, really work with someone who can investigate them, because it's such a key to overall health and especially hormonal health. And
it's important to mention that not everybody's thyroid symptoms are the traditional ones. When I had a thyroid issue, I actually had pain in my left arm for a very long time. And then when I started taking a supplement that was boosting my thyroid, it went away.
Wow, that's great.
Yeah. And someone else I was able to connect with said they had the same thing in pain in her groin for many years, had gone to physical therapy, etc. And then when she supported her thyroid, it went away.
That's
so
great.
Those are anecdotal things, but I say them because thyroid can really be related to, I think it's like 300 different symptoms.
Oh goodness, yeah. And I'll say this one thing, because if I had $1 for every time someone said to me, "Oh, my doctor tested my thyroid and it's fine," I would be a billionaire. But really, most doctors' offices will test TSH, thyroid stimulating hormone. Maybe they'll add a T4. That is not a sufficient look at the thyroid and the thyroid function.
Right.
Also, the lab ranges of normal for conventional medical offices are much different than when I look at them through a functional medicine viewpoint. So my lab ranges are much narrower. And so that's why I say if you have any suspicion that your thyroid is off, get it tested by someone who really knows how to test for thyroid, and that means they're testing not only TSH, but free and total T3 and T4, looking at thyroid antibodies, TPO antibodies, and thyroglobulin antibodies, as well as reverse T3, and then you'll have a much better idea of what's going on with the thyroid.
Wow. Well, thank you so much, Colleen, for being here today. I think we have talked about some things that a lot of people are going to relate to, and hopefully have shed some insight on, the fact that they're not alone as well. I think a lot of women suffer in silence with this type of thing. They think that their symptoms are emotional or psychological, and therefore that comes with a level of shame that they shouldn't really talk about it. And I think there's power in numbers. And if anybody gets anything out of this today, I just want them to know that they're not alone, and that this stuff is real, and that there's things that you can do about it to support yourself. So get yourself a functional medicine doc, or get yourself a group of people who are working towards the same things with optimum health.
Thank you. I'm so glad to be able to share with you today.
Yeah, it was wonderful. Thank you so much for being on the Naturally Inspired podcast. If the Naturally Inspired movement makes sense to you, let's do this together and transform the medical model and help people take charge of their health. Learn more about how you can join the Naturally Inspired movement by going to naturallyinspiredadvocate.com or call me at 970-475-4862.